Go.
Hi, Councilman Garcia.
Hello.
My name is Laura, and I was wondering if you had a few minutes, if I could take a couple minutes of your time.
Yes, I have a couple minutes. How may I help you today?
So I'm one of the many nurses that work here in your community. I actually work at the hospital here in this community as a pediatric nurse. And there's been things that have been occurring within our department, and I was just wondering if I could bring those concerns up with you.
Yes, and first of all, I'd like to thank you for dedicating your time to the community as being a nurse. And how may I help you today?
So my questions to you are, I have been noticing recently an increase in our youth population, especially the teen population, of children coming in with different mental health disorders such as anxiety, depression, suicide. We've had kids come in as young as 12 wanting to commit suicide, and I've noticed that our community lacks in providing resources for these children that are having these different mental health disorders. So I wasn't sure if our different council members, such as yourself, are aware of these situations, and if you are, is there anything you guys are trying to do to change these situations?
Well, first I'd like to say I was never aware of these situations going down here in Yuma. I've heard of it's a nationwide type of problem we have with this issue. What can I do to help so we can help the children here in Yuma?
Well, I've been doing some research and I've been going online and looking at different studies, and I think the biggest thing that we as a community can do to help these children is educate. I think it's very important to educate our community, to educate parents, and anybody who is in a daily contact with these children. I think a lot of the problem is people don't realize or understand that children do have issues, and children can have anxiety, can have depression. There's the myth that children are supposed to be happy and not have any problems. So I think the biggest thing would be maybe creating some outreach programs in educating our community and our parents, and educating children that it's okay to have these issues and that that's normal. It's part of life. My biggest, approach would be really educating our teachers, training our teachers on the signs and symptoms of what anxiety is, depression, suicide, what signs and symptoms to look for, seeing that they're on with our children on a daily basis. They're the ones that see our children every day, see these youth every day. So I was wondering if what your thoughts are about that.
Okay, I will look what I can do, and I'll bring a bill up to the floor, and maybe we can tackle this issue together. Thank you, Ms. Sevilla.
Thank you so much. Thank you for your time. I truly do appreciate it.